Good evening, everyone. My name is Diane Varga. I'm with Family Partners of Morris in Sussex County, and welcome to the Mom Squad. The speaker portion of this presentation tonight will be recorded and shared on our YouTube channel. I ask that all participants please stay muted during the presentation, and once the speaker's presentation is complete, we will stop the recording and open up to questions and dialogue. It is my pleasure to welcome our speaker tonight, Dana Brodhecker. Dana is a licensed associate counselor with the Center for Evaluation and Counseling. Welcome, Dana.
Thank you. I'm happy to be here. So tonight I'm going to be presenting on self-injury or self-harm. I have a lot of experience working with teens that engage in self-injurious behaviors. I have a background with kids with autism, developmental disabilities, and eating disorders. So I'm going to share a presentation that I put together. There's a lot of information here, so I will try to go as slow as possible, and I'm also going to make this information available to you guys afterwards. So bear with me. I'm not too great with technology.
You're in a friendly environment then, Dana.
All right, can everyone see this?
Yes.
Awesome, thank you. All right, so like I said, tonight I'm going to be discussing self-injury. So what is self-injury? I'm sure a lot of us know this already, but just to give a brief definition, self-injury involves a person damaging their own body by cutting, burning, scratching, or practicing any other behavior that results in pain or injury. So self-injury is a common symptom of many other psychological conditions. It is most commonly the result of feeling sadness, distress, anxiety, confusion, or a feeling of numbness. So self-injury is commonly used as a negative coping skill to deal with these emotions. Going through the presentation, I focus a lot on self-injury as a negative coping skill because, like we said, it is a symptom of something else that is going on with the person and or teen. I'm specifically going to be talking a lot about teens, but this can apply to anyone. This can apply to people that are younger than the teenage ages. So self-injury among adolescents. They have the absolute highest rate of self-injurious behaviors. I believe it is around 18% of adolescents will engage in some type of self-injurious behavior. So
Dana, yes. I don't mean to interrupt you. Your slides have stopped.
Oh no. Yeah. Let's see.
Oh, they're back.
Okay. I might just do it this way then.
That's fine.
It seems like it's gonna continue. Like I said, I'm not the best with technology. So if you guys can see it this way, I'll keep it running just like this.
Great.
So self-injury often begins around the ages of 12 to 14. So that's usually the first time that teens are engaging in self-injury. It could be from, seeing friends doing it, social media, it could be a fad, or it could actually be because they need to release some type of emotion and they're just unsure how. Females definitely have a higher rate to self-injure than males. And it's important to remember, just like with anything in the mental health field, that it doesn't discriminate. It can happen to anyone of any age, gender, race, religion, and so on and so forth. So a couple of common causes or things to look out for. People who generally self-injure report that they feel empty, like we said before, sadness. They could be overstimulated. So it can be when someone is in a manic or depressive stage. They're unable to explain their feelings. They feel alone, not understood. It's their way to cope with all of the feelings that they have bottled up inside, or hard to express feelings. A lot of the times teens don't want people to know that they're sad or they're unhappy or any negative, say, quote, negative feeling, because all feelings are good. They just don't know how to deal with it. And generally, self-harm is not a suicide attempt. It's definitely a risk factor for suicide, but not generally when people are engaging in self-harm do they want to engage in a suicide attempt or have suicidal ideations. So the relief is temporary. It can be self-destructive without proper treatment. It's also a way to have control over one's body, or if someone can't control anything else in their lives, that's one thing that they're able to do that no one else can stop them. A lot of people who self injure can also have eating disorders. Like I said, I have a lot of experience with eating disorders with adolescents of different ages, males and females. And a lot of the time, when they have eating disorders, most of them typically engage in some type of self harm. So, some common risk factors there are, of course, having friends or family members who self injure, kind of like I talked about before. It could be seen on social media, it could be because a friend tried it. I've had experience with people who have tried it once and realized that that's not for them. So, it could just be a trial and error of what's working for them and what they're exposed to. Experiencing stressful life situations like traumatic events, family instability, or sexual identity uncertainty. Mental health conditions, like we said, it's usually a symptom of something else that is going on, like depression, anxiety, personality disorders, eating disorders, substance abuse disorders. And those are really just the main ones. It can coincide with anything else that is going on, but we typically see self injurious behaviors with these mental health. So, some warning signs. Unexplained frequent injuries include cuts and burns, low self esteem, difficulty handling feelings, relationship problems or avoidance of relationships, poor functioning. Most of the time, people who self injure want to conceal their marks. They don't want people to know. And sometimes they can even be embarrassed of their self injurious behaviors and their scars. Or on the other hand, we could have people who show them off. Um, you'll notice teens wearing inappropriate clothing, such as long pants and long sleeves, sweatshirts during hot weather. Um, sometimes people won't wear shorts because they have marks on their legs. There can be all different areas, all different things. And like we said, they really do try to conceal it most of the time. So it's important to go over some myths about self-injurious behavior. A lot of the time, people think that it can be a suicide attempt, which it's not. Like we talked about before, it's definitely a strong risk factor for it. People think that self-injury is attention seeking or manipulative. And of course, there's always exceptions, but most of the time it can be a cry for help or a asking for support when they don't know how to and they don't know how to express those feelings or cannot communicate. Um, Another myth is self-injury is not a big deal. It's definitely a big deal and should be taken seriously. Getting help right away is definitely one of the biggest things because they're doing it as a symptom of something else that is going on with them. So why do adolescents engage in self-injury? Like we said before, we have a lot of negative feelings that are going on that they want a relief from. They're struggling either in their minds or outside with other people and their relationships. Um, it can induce a positive feeling. It can release chemicals in your brain. It can be to punish themselves, and it can also to be to feel in control. So, an example that I can give you for someone to punish themselves is, in the eating disorder population, like I said, a lot of them do engage in self injurious behavior. So, sometimes when they eat and they nourish themselves, they have to act out in a different way to punish themselves or to feel in control. So, self injury as a negative coping skill. Talked a lot about this. So here I have what they're expressing, and positive coping skill to go along with what they're trying to express when using self injurious behavior. So, when someone self injures, it can be to express a need for support and they don't know how to ask for it. So, a good positive coping skills to replace it with is writing a letter to a friend, calling or texting to make plans, to see their pain. People will self injure because it's something that they can visibly see, it's something that they can touch, it's something that they can feel. So, another positive coping skill can be to draw about feelings or journal about them. If they're trying to see their pain, art can be a very big thing to do. They can draw out what their pain looks like instead of inflicting it onto themselves. To feel in control. A lot of teenagers want control over their life and they don't have a lot of it. They don't have too many things that they can control over due to their age. So, some positive coping skills could be yoga, to make a to do list and do the things on that to do list, to clean their room, which might not always be the easiest for teens to do, especially, with parents trying to get them to do it when they don't want to, or to take a shower. Those are all things that they can control in their life. To punish themselves, like I just talked about before. So, some positive ways to do that can be to take a cold bath, to dance, or to do the opposite of that and to make a gratuity list or something that they really like about themselves and to make a list of all of the positive things. To stop feeling empty or numb. So, positive coping skills for that could be aromatherapy. Essential oils are great. Mindfulness or grounding exercises. So, the exercise that I have up here is called 5, 4, 3, 2, 1. So, this grounding exercise or mindfulness exercise gets you into the present moment using your five senses. So, it has to do with seeing, tasting, smelling, touch, hearing, and it has to get, or it gets you to the present moment. So, you don't feel numb, you have other senses that are going on. Relief from emotional pain, such as sadness, anxiety, frustration, and anger. So, positive coping skills for that can be walking, listening to music, or journaling. So, self injury is big in negative coping skills. So, being able to give a positive coping skill to replace it can be really beneficial. And then on the other hand, parents are experiencing this almost just as much as their kids are. There can be a lot of mixed feelings going on when you find out that your teen or your child is self injurious or self harming. It can be upsetting and stressful. Um, you can feel anger, sadness, helplessness, shame, or even disgust. Parents might even blame themselves for why their child is engaging in that. It's normal to feel all of those emotions, and important to understand them and accept them so you don't misredirect them at your child or misunderstand what your child actually is needing. Um, Parents frequently report guilt, shame, and fear of exacerbating the self harm behavior. Um, can result in losing confidence in parenting skills. They can have difficulties communicating with their child about self injury and feeling uncertain about how to address the topic because it's a tough topic to talk about, especially with teens who don't want people to know, who don't want to express that. It can be very difficult for both the teen and the parent, but making sure that you are open and have a communication and a dialogue supporting each other is going to be a key factor in how those conversations go. The stigma associated with self injury can cause isolation. Um, there's always a stigma for any mental health. And people are afraid of that. They're afraid to get help because they're going to be labeled or someone is going to look at them in a different way. So it can cause some isolation. And try to think of this behavior as an expression of a deep emotion that they cannot handle. So as much as it's going to be very difficult for the parent, it's going to be very difficult for the teen as well because they don't know how to express their emotions right now, which is why they're probably engaging in some self-harm. So some tips on how to support a child or an adolescent or a loved one could be to be patient and to learn about self-injury, which is why everyone's here tonight. To be aware of what it is, why it's coming about, the risk factors, what to do when it happens. And the more knowledge you have and the better prepared you are, the easier going into that situation is going to be. It doesn't seem as scary when you have the knowledge and the resources to address it. And do it as soon as possible. Validate the child's feelings. Remember that it's different from validating the behavior. So we want to validate their feelings and what they're feeling, but also make it known that self injury is a negative coping skill and move on from there and see what can be helpful and how to support. Speak to your child in a calm tone, offer reassurance, and be respectful. Active listening is something that we do a lot in therapy, to be present in the moment, to understand what they're saying, and to paraphrase back to them what you think they're saying if they're not really making sense, and allowing them to correct you if you're wrong. Check in to see how they're doing regularly. Ask open-ended questions so they don't feel like they're being blamed or accused of something. Ask them what they need for support. You know, a lot of the time they might be insightful as to what type of support they need. They just don't know how to ask for the support because they're ashamed, embarrassed, or some other feeling is going on along with this. Take it very seriously, like we talked about before. Give praise for positive changes as you see. It's very important to focus on short periods of time and just one success at a time. Um, it can be really hard to look at the good when something so difficult is happening in that moment, but making sure that you're giving that praise for every little step of moving away from a negative coping skill into a positive coping skill. Focus on your child. Of course, I say that because they're the one that is putting themselves in danger. But on the other hand, you also have to focus on yourself in another way and give back to yourself and have that self care so you can support your child. Parents can feel very overwhelmed or wonder what they did wrong. It's important for parents to find supports as you're helping your child so you are not taking that out on the kids or directing some of those emotions on the kids when they just need someone to be there for them. So, making sure you're taking care of yourself, getting into support groups, doing research, talking to someone, um, and modeling what good self care looks like. So, when to call for help. If someone displays the signs and symptoms of self injury, a mental health professional with self harm experience should be consulted immediately. An evaluation or assessment is the first step, followed by a recommended course of treatment to prevent self destructive um, behaviors from happening and continuing. So, once you are aware of the self harm, it is really important to try to set up supports and to make sure that the child is getting what they need in regards to their feelings and making sure that they're taken care of physically and emotionally. So, a really cool, helpful, I want to say it's a brochure, is Coping with Self Harm, a guide for parents and carers. I have this downloaded onto my computer, which I'm going to share once I share all of these slides. But I do want to have you guys see this if it'll open up because this is very, very resourceful. Um, might not. Let me see if I present it. Might not work. I will make sure that everyone who is here during this presentation gets a copy of this. But it is a brochure and it has a lot of the information of what I just presented. So it has a lot of steps to take, what to do, some coping skills, and it's a great resource for anyone who has a child that is self-harming, or just general knowledge for people to have about self-harm if they have kids or any loved ones. There's my information if anyone needs to reach out to me or if you have questions after this. I'm more than happy to help as much as I can. So you can reach me at dana.brodhecker@centerforeval.org. And we can stop and go to some questions.
Thank you, Dana. I just wanted to thank you for your time for presenting to the group on this very important topic. At this time, I will stop the recording and open it up to questions.
Hey, so I have a question.
Sure.
I know, hi.